Good morning, good afternoon, good evening, everyone. Welcome back to the joint online training program on making cities resilient, developing and implementing local disaster risk reduction strategies to respond to COVID-19 and to better prepare for the future. The course is jointly organized by the UN Office for Disaster Risk Reduction, UN Office for South-South Cooperation, and the Pan American Health Organization. And before we are starting, I would like to do a bit of the housekeeping announcement. Um, the course will be run in English, and you have an option to also listen in Spanish by clicking the globe icon at the bottom of your Zoom panel and choose the Spanish channel. And we'll be using the Q&A box for asking any questions. Don't drop the questions in the chat box because we may miss your important question. And we also have already shared the course material, including the PowerPoint we'll be using for today in the workspace. And lastly, all participants completing 4 out of the 5 sessions and completing at least one of the post-session course survey will be receiving the certificate of participation. So we are now with over 600 participants already. So let's get started. We are already midway now in the course in week 3, and we'll be covering about the disaster resilience scorecard for city, as well as the public health system resilience scorecard addendum, which is the tool that cities can use to help improve resilience planning. And the session today will run for 60 minutes. So let's get started. We did cover in week 1 about the concept of disaster risk reduction and also disaster risk reduction at the local level. We have stressed also that city is actually a system of systems because there are so many different sectors working together to make up the cities, whether it's healthcare, whether it's other infrastructure, whether you're from education system where you're working for disaster management, and etc. And these are the players within the government and the entity within the city needs to work together to ensure that the cities are safe and providing well, basically being safe and can build resilience together. And it goes beyond the government into also engagement with the communities, private sector, and media, etc. I've also seen a lot of discussion going on in the workspace discussion among our participants, and you guys rightly mentioned that it's everyone's business to make your city resilient, but it's also the critical role of the government to make sure that there is a good plan and there's a good vision of where you want to take the cities towards this resilience building journey, and identify the actions that you can do collaboratively to make sure that every systems within the city is working well together. We also covered about the guiding principle of the Making City Resilient campaign, which is the 10 essentials. Just a recap on that. On the left hand is the 10 essential from essential 1 to 10 that details out the concept of disaster risk reduction into a bit more tangible 10 basic things that cities should be doing to make sure that you're starting your journey correctly in resilience building, and go beyond emergency response and recovery planning into also addressing many of the aspects about disaster risk governance, and also integrating a lot of the risk reduction components within your urban planning, use of the nature-based solution, strengthening different parts of the government and non-governmental stakeholders' capacity, and ensuring that the city's infrastructure is resilient. And today's the disaster resilience scorecard for cities will bring you beyond understanding the concept as a starting point into having the tool to be able to apply this concept and integrate that into the work that you are doing that pave the ways towards a comprehensive and good resilience planning for the city. So the disaster resilience scorecard for city that we will be talking about today, we call it in short a scorecard. Many of the cities that are part of the Making City Resilient campaign since 2010 may have heard of many of other tools that we also use to support local government in self-assessment on disaster risk reduction and resilience. As for example, the local government self-assessment tool or the LGSAT. This is being replaced now by the disaster resilience scorecard for city, which have been amended to ensure that it's aligned well with the Sendai framework for disaster risk reduction, or the priorities actions that should be integrated in disaster risk reductions are embedded in this scorecard. And it was developed in collaboration with IBM, ACOM, and was launched in 2017. The scorecard does come into two levels of assessment. One is preliminary assessment, which is the one that we'll be talking about today, and the detailed assessment. And looking at the name, you can guess the preliminary assessment is a shorter version that has 47 indicators with a simple scoring between 0 to 3. And it's very good to use for the cities to engage with multi-stakeholders who may not be so familiar with what disaster risk reduction is. So it's a very good tool to help you to convene and start different conversation with different partners, different stakeholders within the city. Then there is another set, the detailed assessment, that has 117 indicators of the questions, and the scoring criteria is more granular from 0 to 5. And this is very good also for the cities that have a bit better understanding of disaster resilience, and we'll be able to use that to really help plan out in more details the type of actions that should be included in your risk reduction and resilience planning. Then each of this scorecard, there are two versions of them. So one that comes in PDF, so you can print out in booklet like this, that give also a lot of narrative details about the concept of the 10 essential, what they are, the concept of the system of systems, so you can really like read through and use it as a reference material. Then there is this Excel tool that convert all of these questions into the Excel format so that you can use to input your scoring, and it will also show the pictogram analysis of your scorecard assessment result. Now, so let's go into this preliminary level assessment of the scorecard. Here is a sample indicator and the scoring. So it's one of the question within Essential 1 that focusing on the plan making. So the question would ask, for example, this: does a city master plan include and implement disaster risk reduction approaches in line with the Sendai framework? And you have the choice to choose the answer between 0 to 3. 0 for your city if you don't have any plans. 1 for your plans that have some of the elements according to 10 essential, maybe focusing on emergency response for most part, but not covering in any other part on disaster risk governance or urban planning and etc. Or if you have a comprehensive plan that addresses all of the 10 essential and the Sendai framework, but it's a standalone DRR plan, then you can score 2. But if you have the plan that is fully integrated into urban development plan that cover all of these risk reduction elements, then you can score 3. So you can see that the question is pretty simple, and the scoring is also pretty explicit. And by scoring this, you can see also your baseline, current progress of how your city is doing. And if you're not scoring 3, definitely you can see what are the gaps and what could be the potential area of actions that you can take to make sure that you're going a step up in terms of your risk reduction planning. Then in each of the essential, you will in each of essential there are this box that portray the questions and answer. So in this Excel tool, there will be a lot of circles in the top part. You will see here is essential 1 to essential 10. So if you click here, you go into Essential 1, and you will see the questions that come into this kind of box. In box 1, there will be the place that give you detailed questions with the comments in here to detail out some of the terminologies or what the questions actually intends to target. And you have the options here to be able to score and to provide also the means of verification in the box that highlight in number 2. This is very important because you can see that the scorecard can be very subjective because it's a question and answer based on your understanding of what the answer could be. So we really encourage that this scorecard is not done by one individual or one organization or entity, but you use this as a tool to bring a lot of the multi-stakeholders together in one room. Usually the workshop style helps as well to bring people in the same room and start discussing about these questions. And because some of the people may come from different background with different knowledge, the interpretation of the answer may be different by individuals. So this can be the tool that you can start dialoguing why one person understand it different way, the other person also understand it in another way. And by that, having this discussion and dialogue, you would be able to start documenting what would be the common understanding of this people in the room, the people within the cities, about what your current stage of the city is doing for that particular questions. And to document that kind of understanding and the evidence use in justifying the answer is very critical also for yourself to come back and see why you scored that way in a different point of time in the future. There are also some spaces that you also can document the actions that you have discussed that could be done to actually improve your scoring, and also identify who is responsible for that and the time scale for the action to be taken. So within here, I'll give you some examples of the type of questions that are integrated in this scorecard. So in Essential 1, Organizing for Disaster Resilience, there are questions that focuses on the plan making, whether there is a multi-agency teams established in the cities to do the organize, to coordinate the participation of the different stakeholders, and whether the city has started integrated some of disaster risk reduction in elements in many other development issues within the city. There are also questions in Essential 2 that talks about understanding risk, that would ask you about your understanding of the exposure vulnerability, the hazard assessment, the risk information, and whether you understand the cascading impacts of the different scenarios, risk scenarios that may happen in the city. Essential 3 on strengthening financial capacities. There are also questions asking whether you understand and know where could be the potential source of funding available for risk reduction, whether the city has a ring-fence budget embedded for risk reduction purpose, or whether the city has been utilizing insurance schemes or have established any kind of incentive to attract different government sectors and also private sectors and the citizens to start invest in resilience. And there are many other questions that you can also refer to in different essentials within the scorecard, talking about building codes, about the land use planning, the use of the green and blue infrastructure, which is pretty much using the park, the forest, the mangrove forest to absorb the storm surge, or the retention pond, the riverways, and stuff like that, including the issue about transboundary environment issues in your risk reduction actions. Then in terms of Essential 6 on institutional capacities, it also focused on asking the city to reflect whether there have been education programs, training programs, or whether different institutional officials have the skills and understanding what disaster risk reduction is, whether these trainings and capacity building programs are available in the local languages that the people within the city understand, and whether the city learns from each other. As well as in here, Essential 7 has the questions asking about how much the city is engaging with the communities in your risk reduction actions, including the vulnerable groups, and whether the private sector has understood and are doing the business continuity planning in how they are running business to ensure resilience, for example, and many, many more. In Essential 8, focuses on the infrastructure resilience. So there are the questions about whether the infrastructure within the city can withstand the damage and losses that could potentially be caused by disaster. And there are also specific questions targeting different infrastructure sectors, development sectors, transportation, communication, healthcare. And you can see here that for focusing on the healthcare question, there's only one question focusing on the healthcare system in terms of resilience building in the preliminary scorecard assessment. And that's particularly why we also have an addendum on the public health system resilience that address many more questions to ensure that city is integrating the pandemic and the cascading impact arising from the pandemic, and how the city is coping with this health resilience within the cities. And we will be covering about that addendum in the latter half of today's training. And Essential 9 and 10 has the usual questions about the response plan, early warning drills, the responders, food, shelter, and the recovery part focusing on the recovery planning, the build back better component, and also whether you are learning from the past disaster in the way that you are recovering your city. Now, this is a very crash summaries of what the questions may look like. And I would like to take the next 5 minutes to actually get you to do some of the sample questions by completing this poll. So I'm going to be sharing the poll here on the screen. I hope you can see them well. There are 3 questions that are taken directly from the scorecard preliminary assessment. What I would like you to do is to read through this question and answer the 3 questions. I'll give you 3, 4, 5 minutes to complete that. The first question focuses on the cascading impacts of disaster taking from Essential 2. Whether is there a collective understanding of potentially cascading failures between different city and infrastructure systems under different scenarios. The second question focuses on Essential 6, on learning from each other. So whether the city is proactively seeking to exchange knowledge and learn from other cities facing similar challenges. The last question is taken from Essential 8, focusing on healthcare. Would there be sufficient acute healthcare capacities to deal with expected major injuries in worst case scenario? So I'll give you a few minutes to read through the answers and complete the poll. And we currently have 774 people in this room. So I hope that we can reach at least 50%, 60% of the scoring in the next few minutes. There is a question in the Q&A that I see. What if you don't know the answer to the question? of course, definitely not everyone would know the answer, and that's particularly why when you complete the city resilience scorecard, is encouraged that you bring in as many stakeholders as possible within the room. Because, for example, this question about the healthcare system, if you're working in fire department, you might not know the answer. So you need someone who are from the health department to be in the room to make sure that the correct um, realistic state of what your city is doing is reflected in the answer. If you cannot see the poll from not joining from joining from the browser, it's okay. This scorecard assessment may be your self-paced homework, the assignment. So you still have the chance to actually look through it at your own pace after the training, to get to see what kind of questions are really included in there. And we are very open to feedback with you if you need our support in clarifying any points. Okay, so we are about 55%. I'm gonna close the poll in 15 seconds. It's very good. We get about 59% now. Okay, I'm ending the poll now. Thank you. And now we can see the result on the screen. There is no one correct answer in this, so don't worry about this score, the color of the scoring, but you can see that the majority of the score are reflected in orange. Imagine that if you're actually coming from the same city and you are working from, like, you're coming from different background, different work environment, different expertise, and you come into the same room, you read the same question, but you answer it totally different from 0 to 3. This is really why the scorecard is a very useful tool for all the city stakeholder to start discussing why you answer this one, some understanding of cascading impacts under some disaster scenarios, while some people in the city actually say that, oh, we know everything that could happen within the cities, and etc. And yeah, so this is just one of the examples of what the question looked like within the scorecard. And I really encourage you to really go back and complete them at your own time. And if you are able to actually gather a lot of your CT members to do a workshop style and facilitate this scorecard assessment together, do let us know if you need help for us to introduce how to use a scorecard with your team. So let me stop sharing the result of the poll here. And thank you for participating. I hope this was useful for you to understand what the question looked like. Now, coming to analyzing the result. In the scorecard Excel tool itself, after you complete the scoring, you can go into the result tab on the top right hand corner, and you will see this pictogram and the overall score of this assessment 0/141. The total score is 141 for preliminary assessment because there are 47 indicators, and each of the indicator is has the maximum scoring of 3. So the gray area here display the maximum score possible. Why it's the gray area? Because each of the essential has different number of questions. For example, in essential 1, there are 3 questions. And so the maximum score is 9. 3 times 3 is 9. So you get the maximum score here. And Essential 2 has 5 questions, so the maximum score is 15. That's why the gray area is the boundary. Now let's see this one. The result of the assessment is shown in blue. So here in this city, what do you think the city is doing, how it's doing? It's scoring full 141/141. So they are scoring perfect. But this is not likely the case that you will see in reality. Let's see this case. This is a bit more realistic. What do you think how the city is doing? It's scoring 84 out of 141. You can also see from the pictogram here that the blue area is their achievement, but the gray area are still the gap or room for improvement for them to be able to achieve the maximum resilience. Now, what it can tell you beside this gray and blue area is to compare across the essential. You can see here in essential 1, the blue area is maximums here. So the city is actually doing pretty good in organizing for resilience in essential 1. It also does pretty well in essential 4 in terms of urban resilience planning, but it doesn't do well at all in essential 3, where a lot of gray area here you can see in financing for resilience. So you can use this to help the decision maker to see the weak areas of the cities, the strength area of the cities, and decide what could be the priority areas that you should focus on in the next round of your disaster risk reduction planning. You can also compare across essential and within this essential. Here in essential 1, you can see, as I said, that they're scoring perfect, completely blue. But here in essential 2, there are some questions that they score well and some questions that still are rooms of improvement. So you can go into details of the questions, what kind of thing that the city should further improve. Or here it says a cascading impact. The understanding of cascading impact might not be so well. Then in here in essential 3, definitely only here slight blue tab here is about understanding where the sources of fund is, still very low, but the city is not using the other incentive. There is no ring fence budget, there is no insurance scheme, there are no incentive that has been used to help the cities in risk reduction investment at all. So then this area can also be used to explore what can be done better in your next round of the planning. You can also download the report of this scorecard assessment and also the input of the scoring here. And the scorecard is very useful for you to use as a baseline measurement. So when you develop your plan, if it's based on the scorecard assessment, then your plan is based on the evidence that you already have discussed within the city. What are your strengths, what are your weaknesses, and what are the priority areas? So it also can reflect your needs and can further make your plan a needs-based and evidence-based planning. It also helps to create awareness, understanding about why disaster risk reduction is also connected to many other people working within the city, so they know that they have the responsibility also take actions in risk reduction. It helps to create a dialogue among different stakeholders within the cities and definitely help you to be able to prioritize the action. We don't focus on comparing the scoring between cities. So if you see this scoring, for example, the intention is really not to compare it across different cities, but it will be useful for you to reflect your realistic scoring. So you don't need to score as high as possible, but you do it as realistic as possible so that you can see your best, the actual baseline. And we encourage you to redo the assessment after a couple of years and revisit to see how much you have improved in some of this area, so that you can use it also as the benchmarking tool in planning across the multi-years of planning and action. And many cities have been using the scorecard in their planning purpose. We have reported over 800 cities at least that have been using this over time since the predecessor version of the tool. Cities in different regions, American Guayaquil, we have city in Mongolia, in Bangladesh, and etc. that are doing. And so like you can see that they are bringing also different stakeholders in doing the scorecard together. There are also technical expert groups that also may dig out a bit more research and do the preliminary analysis and bring that into further discussion with a wider group of stakeholders. Cities also were able to use this to convene different stakeholders as well as the political leaders, the mayors, and be able to influence neighboring cities to do the same, so that when your cities are becoming more resilient, your neighboring cities follow suit, you also benefit from the transboundary interaction with these cities. And yeah, so you can download the scorecard from the Making City Resilient campaign website, which the links are here, and we'll be dropping the links also in the chat box. And it will be your homework, as I said, to complete this scorecard or the scorecard that Sanjay will be presenting next after this, which is the the health scorecard, public health scorecard addendum. So you can choose whether you want to do the city version, the public health scorecard addendum, to widen your understanding of the use of this scorecard. So that's it for the city scorecard, and I will pass on the floor to Sanjaya, and in the meantime, we'll look through the question and answer, and we'll come back to answer the question live later on at the end of the session. Thank you. Over to you, Sanjaya.
Okay, thank you, Mai. And there are some questions regarding where to send the scorecard report and so on, so you can have a look at that. So again, let me now talk about the health scorecard. I think you should be able to see my screen now. So now, when we look at resilience, we have to remember that resilience is not something that can be done in very less time. It takes, it's a long process. Some actions can be done in days or weeks or months, and there are other actions which can take many years, even decades. So, so here there is a plotting of some of the possible actions that can be taken for achieving resilience. And as you can see, there are some things which could be done in a day or in hours, which includes evacuation, for example. But then there are things like rebuilding and economic recovery, which can take years, even multiple years. Now, when we look at the COVID situation or a disease situation, again, we have things that can be done in a day. So increasing awareness, contact tracing of the first cases, this can be done in days. We can set it up. In months could be, for example, the lockdown. In years could be the vaccine, and then the economic recovery. So the whole idea is to show that achieving resilience is not going to happen quickly. It's going to take time. And some of you have asked this question also. You know, what was the frequency of using the scorecard? So if the city uses the scorecard, probably they should relook at it after, let's say, 3 to 4 years, so that there is some progress, and then that progress can be monitored, or 3 to 4 years or 5 years, but it should be done again and again and again, because with time, not only the score will change and there will be progress in resilience, but there might be situational changes. So demography might change. In a small town, if there is a chemical factory is established, then the risk factors increase. So it can be many things which change, and therefore it's a good idea to revisit the scorecard after a few years. Now, this is just to show that the resilience is, there is a very clear vertical linkage between the government and the community, and between national government and local government. So the government can provide, collects data for their operations. They can provide information to the public. The community can enable self-help with each other, and then bottom up is again the community provides the data to the government, which the government uses for analyzing trends. And if we look at the COVID situation, it is similar. The government provides the business opening instructions. So after lockdown, when can the business open? How can they open? They provide advice on symptoms. The community can help in the contact tracing and neighborhood resources by helping people who who need help. And again, the bottom up between the community and the government is the applications for help, as is happening right now. Community members and also small businesses are asking for financial help from the government. So just basic idea is to show the link. The community, the local government, and the national government all have an important role to play in resilience. Resilience cannot be achieved independently of by any one of them. They all interact. Now, we also have to see that apart from the events which we know, earthquakes, floods, and now pandemic, there are also the chronic stresses. So, and somebody had asked a question, how inclusive should the resilience strategy of a city be? It should be as inclusive as possible, because if you leave out the poor, or there was a case in one country, for example, where the lockdown was done suddenly, and a lot of the so-called migrant labor, people who moved from village to town to work, they were suddenly without jobs, and then they had to move back. So they had to defy the lockdown and go back to their village. So it defeated the whole purpose of the lockdown. So one has to be aware of what are the chronic stresses, and the stresses could be environmental, economic, which means poverty, and so on. And these become more enhanced when a disaster happens. And when we look at the pandemic also, we can see that, for example, the event is the pandemic, COVID-19. But what it has done is it has forced businesses to close. As a result, the small businesses are suffering. Many are going bankrupt. The people who are employed in those small businesses are jobless. And public transportation systems are suffering. People are not using public transportation. Uber, car rentals, taxis, all are facing loss of business. So the chronic stresses, they become more acute or more enhanced because of the pandemic. The World Bank says that 40 to 60 million people will move into extreme poverty this year just because of COVID-19. Also, we must understand that resilience is about system of systems. So it's not civil defense or emergency planning by itself. It's all the sectors in a government, in a city, or a local government, in a town or in a village. All of these have to work together to achieve resilience. And here you see the health area is showcased, because this is one of the sectors which kind of slipped through the cracks. In 2015, the Sendai framework talked about biological hazards, and then after that, and that came because of the Ebola outbreak around that time. And after that, we had Zika, we had SARS, we had MERS, and yet none of the governments understood the possibility of those were epidemics restricted to certain areas, but nobody understood the possibility that there could be a pandemic, which means spread all over the world. So all the systems have to work together. And as we see in this pandemic, if you see all these other sectors, all have been adversely impacted by the COVID-19. So even fuel, the prices of oil have crashed, and all the economies which were basing their large part of their revenues on oil trade, they are now suffering. So every sector gets impacted. Now you looked at the city scorecard, which Mai has just shown you. So that has some questions on the health sector. There in the scorecard, there is one section on a few questions on the health sector, but doesn't cover everything, and it's not comprehensive, and it's mostly focused on the infrastructure. So when we talk about the health sector, it is much more. Now, and I think everyone is now realizing, because of the COVID-19, that many interdependencies exist. So we talk about not only hospitals and isolation facilities, we talk about nursing homes, we talk about emergency systems, we talk about mental health, we talk about laboratories and testing facilities, but also water and sanitation systems are important. Food distribution, pharmaceutical and medical supply, environmental health, staff, and community outreach, non-profit organizations, law enforcement, the police, and fire, the transit system, which means the public transportation system. All of these are interlinked with the health system. So if the health system fails, which could be due to a pandemic, then all of these are impacted. So what does the public health addendum cover? And I've shared the link with you, and then I think one of my colleagues can share again the link for the scorecard, for the public health scorecard, and all other tools. You should go to the MCR campaign website, and you can go into the toolkit, and you will find all these tools there. And please note that the scorecard and the public health scorecard, these are available in a number of languages. So you can see that, find the language that you require. So the scorecard, again, this one, the health addendum, as we call it, looks at the same 10 essentials, which Mai has already talked about. And it covers all kinds of areas within these 10 essentials which impact the health system. Now, there are some questions which are purely for the health sector, and there are some questions already there which are very relevant to the pandemic. Now, you must remember that this health scorecard addendum was developed in 2018. So 2 years ago, and before the pandemic. But still, it covers issues like, does disaster risk planning include public health emergencies? Are sufficient skilled professionals available? So as you saw, even in many countries, in most countries, there is shortage of beds, there's shortage of staff to look after the sick. Are communities maintaining, monitoring infectious disease alerts? Are they getting those alerts? Can the health facilities manage a surge of patients? So somebody had asked what can we do for a mock drill for the pandemic. So for the mock drill, it can be a tabletop exercise with all the relevant departments sitting in the room and then looking at various scenarios of a pandemic and how each department will contribute to managing the situation, looking after the people who fall sick, tracking them, tracing them, and preventing spread of the disease, and providing surge capacity of staff and of supplies, PPE and other equipment and medicines. So this is just to get a feel of it, what it looks like. And Mai has already shown the scorecard. This is the public health addendum. It's built along the same design and same standard. So one example of a question: to what extent are emergencies and disasters, including disease outbreaks, included in risk planning? So again, the scoring is 0 to 5, same as the scorecard. And then you see where you are, and then you can decide what kind of actions you need to take. Another example is, so there are a total of 25 questions, but this example is: to what extent are the workforce and skills required available? So this we are seeing that due to in a disaster, the situation is different, because when there's a disaster in one city, you can get surge capacity from neighbors, from neighboring cities, neighboring towns. But in this case, in the pandemic, it has mostly been quite widespread. And as a result, it has been difficult for governments to provide the surge capacity. In China, they did do it. In Italy, they did. But in many countries, it is becoming difficult to do that. And then when you talk about health staff, it's not just about doctors and nurses. It's also about psychiatric care. It's about the care home. Care home is where the old people are, senior citizens are staying. So their staff, the pharmacists, the epidemiologists, the supply chains, everything is can be impacted, and you need surge capacity for all of this. Another, so now here is: to what extent are hospitals able to manage a sudden influx of patients? So we read every day that, for example, currently even in Korea, they are saying that about 80% of the beds are occupied. So if they may need to establish more beds. And many countries are doing that. They're setting up temporary facilities. They are taking over hotels and hostels and converting them into beds. But then with the beds, you also need the nurses, you need the doctors, you need the technicians, you need the supplies. So it's not just about getting beds. So it's quite a complex situation. But again, 0 to 5 scoring, and then you go ahead with that. So this is the link. And you can download the scorecard from here, and the health scorecard, and it is available in a number of languages: English, Arabic, Spanish, and I think a few more, Turkish also, and more. Now, how it can be used. So some of you had asked also about this question, that in the scorecard there could be, how can we normalize the scores? So to do that, what is required is a multi-sectoral, multi-stakeholder approach. If 2 people sit and do the scorecard, there will be bias. But if 40 people or 50 people sit together and do the scorecard from different departments and some civil society organizations and others there, then the bias will be reduced. So the way to use it is a workshop-based approach, to identify all the key stakeholders who should be in the room, and then establish the workshop, do the workshop, have them all in the room, or currently do it virtually. So in this call right now, we have more than 800, almost 900 participants. So it is very easy to do 40 people or 50 people in a Zoom call, and then do the workshop. And then People will take time. Not all the questions can be answered in that workshop. Maybe they have to go back, they have to do some research, they have to find out some data and information, and then they can complete it. But at least this, in the workshop, they can all get together and agree on the scores. And then based on the scores, start developing an action plan. What are the actions? So if I'm scored 2, I want to be 3. How can I move from 2 to 3 in let's say in 2 years? So what are the actions I should take? That starts forming the action plan. And this is a typical agenda where you're using both the scorecard and then the public health scorecard. But it doesn't stop you from using the public health scorecard straight away. You can also do that. And if you do that, you can reduce to a couple of days. You can do this in 2 days. And these are some of the resources available and the links to that. But as you know, MCR campaign website or toolkit, that's where all the tools are. But other than that, if you want to find more details and publications, it is the prevention web. You go onto the prevention web, you will find all kinds of tools to use. And that brings me to the end of my presentation. Thank you for your attention.
Thanks, Sanjaya. So let's go into some of the question and answer. Maybe you can also help to address some of the questions in the Q&A. There are some about the public health addendum. In the meantime, I just want to share with you about the self-paced assignment. Again, you can choose to do either the city scorecard or the public health scorecard addendum. It's not a compulsory part as a requirement for the certification, but what we would like you to do is to understand what kind of questions are included in there and to be able to see really how it can be applied in the way your city is doing the planning. So I really encourage you, even though it's not a requirement for the certification, and you can send in the assignment as well as your short feedback about the use of the scorecard to the email that I'm dropping now in the chat box, isdr-campaign@un.org. I'll make sure that I also send that to all of you through the workspace and the emails after this week session. So I'll pass on the question to you, Sanjaya. I see now that there's a question about, does the scorecard addendum cover about the mental health?
Yes, it does. And that is a very important aspect, by the way, of the health, not only of the health, but also of recovery. So yes, it does cover. And as you saw in the presentation also, it looks at surge capacity of mental health professionals. And I'm looking at some of the questions. So okay.
There was a
so
question.
Yeah, do we need to apply 2 scorecards, the health and the generic, for assessment? So as I mentioned, ideally you should, but not necessary. So you can go into the health scorecard directly. You don't have to, because for example, considering the situation currently and the urgency, you can go directly into and do the health scorecard. And though the health scorecard is made for local government, but there are national governments also which have used it. So the questions are relevant also for the national government. So yes, in the current circumstances, can go ahead and do it directly.
Yes, and There is also a questions of whether they can use the presentation material when they conduct a workshop in the city. The answer is yes. The material that we have used today, if you would like to use further with your cities to apply the scorecard, yes. And if you would like to conduct subsequent trainings or orientation session with the city and you need our support in that, feel free to reach out to us. There's also a questions of how many years should the scorecard be updated?
Yes, so this, as I mentioned, typically you can use a scorecard, the scores for your DRR plan, and then obviously when you have a plan, you need to give some time for implementation and to achieve progress. So maybe 3 years at least, or 4 years even, you wait and then you do the scorecard again to capture the progress and also to find new areas where you can use your focus. And then there was a question, who should promote the scoring in the city? Is it the government, the local government, or the community itself? It could be anyone. But ultimately, it is the government that has to do it, because it has to be people who have the decision-making power, who can decide policy. So because the scorecard is for local government, so it will be the local government. And there are a large number of local governments around the world which have used the scorecard. So the local government should be doing it. The community will be one of the stakeholders, but will not, if the community does the scorecard, it will not translate into policy and actions unless the government is backing it. So it has to be the local government.
I just want to piggyback right on Sanjay's answer a little while back about how often we should do the scorecard. One of the way to make it as part of the planning cycle is that you use it to develop the evidence-based information in your planning cycle. So if you have the urban development plan or disaster risk reduction plan with 4-year cycle, 5-year cycle, every time that you are revisiting the plan, you should use the scorecard to help support that, to create those evidence. There is also a question whether preliminary and detailed is a sequence, meaning that whether the local government should do both or no.
Preliminary and detailed, yeah, I've answered that question, that ideally you should do the preliminary and the detail, but there are some who have done preliminary and then detailed. They've looked at the scores, and if they've scored like, which is up to the city to decide, but for example, they scored 3 or less, then they go to detailed for that. So, but ideally preliminary, then detailed, that's when you'll get the most comprehensive assessment and the best plan. So that is the ideal situation, and it's not rocket science. These workshops, if the right people are in the room, if the correct stakeholders are all in the room, all the different sectors are there in the room, they can a 3-day workshop can get you through the scorecard at least. So, and maybe a little bit more back and forth on some research or gathering data, but in 3 or 4 days, it should be over. But for the assignment, somebody has asked that, should we do we have to do the workshop for the assignment? So no, not for this assignment. That is just your homework to do yourself.
Yeah, just for you to understand about the scorecard. There's also a question that one of the students wants to use the public health scorecard to compare cities' resilience for her thesis. Do you discourage this? As I said, we do not intend for the scorecard to be compared across the city because, well, we also have experience when we conduct a scorecard and some, like decision maker tends to score it higher than the officials or who are on the ground that want to reflect it more realistically. And if you encourage this to be compared across the cities, then one of the motives for city to complete this is to really score high, not to score realistically. That's why we do not encourage the comparison across the city. for the assessment. But what can be done is I also will be sharing one publication on the Making City Resilient report. I'm dropping it in the chat box now. It's a study that we use to do the analysis of the 214 scorecard assessments. But we don't review which city they are, just to see the overall picture of, in general, where are the progress of the cities along these 10 essentials. That was the only analysis that we would encourage you to do, but not to compare one city over the other. Yes. So there are a few more questions.
We are done on time.
Yeah, there are a few more questions. We'll look through that and we'll try to address it in writing. And we'll be sharing also the questions from previous weeks that we also have ready to be shared with you also in Workspace in the coming days. So we are wrapping up this week's session, Sanjaya. And next week, what we'll be doing is we're gonna go over, the session will be covering about planning for disaster risk reduction and give you some of the examples of how cities have been using this scorecard result in the way that they plan and set the priorities in the disaster risk reduction plans. And we also will be sharing some of the cases of how many of the sectors integrate disaster risk reduction in their actions. And yeah, so stay tuned for that and see you again next Tuesday. Thank you. And Sanjay, you have any other final words before we depart today?
No, thank you for your participation, and do look at the tools and go on the website definitely and have a explore all. There are many other tools which we have not talked about, like quick risk estimation tool and UScore and others. So have a look at everything, because there is very helpful material available there. And yeah. Thank you and bye-bye.
Thank you and have a good night, good day to you all. Bye-bye.